I'm checking the door signs for isolation, NPO, fluid restrictions, fall risk, or daily weight.
Come in.
Hi, my name is Rebecca. I'm a student nurse from South Florida State College. I'm here to do your head to toe assessment today. I've cleaned all my equipment prior to coming into your room. Put my barrier down, and I'm going to write my name up on the board so you know who to call for when you need some help, okay? I'm gonna go wash my hands. Can you tell me your first and last name and date of birth?
Teresa Lever, July 13th, 76.
And do you have any allergies?
No.
Do you have any allergies to latex?
No.
Okay. I'm going to make sure the overall appearance of the room is clean. I'm going to make sure the head of the bed is all the way down and side rails are up. Is it okay if I bump your bed?
Yes.
Okay. Do you need anything before we get started? Do you need to go to the restroom? Are you comfortable? Or do you need any type of pain medication at this moment?
I'm good.
All right. I'm going to raise the bed up. Okay. Have you had anything hot or cold to drink in the last 30 minutes?
No.
All right, here's your temperature. 98.3. I'm going to clean my stethoscope. I'm going to go underneath the gown. Heart rate is 70 and regular. I'm going to grab my, do you know what your baseline blood pressure normally is? What it normally runs?
No.
Okay. I would check the patient's chart for any baseline vital signs. Have you had any accidents or injuries to either arm? Have you had any breast or chest surgery? Have you had any circulation problems? Do you currently have any circulation problems?
No.
And looking for dialysis ports, any type of edema, or IV sites, which is on this side. Okay. Clean my stethoscope again. All right, 120 over 60. I'm going to check for respirations. 18. I'm also going to check for oxygen pulse, oxygen saturation. 98%. Alrighty. Do you have any pain right now?
In my head.
On a scale from 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you rate your pain?
3.
When did it start?
Yesterday.
Where's the location of it?
In my head.
Is it to a side or is it all over?
Right side.
Okay, and when, how long does it usually last? Is it continuous, comes and goes?
Continuous.
Continuous headache? What does it feel like?
Sad.
Okay. And what makes it worse?
Nothing.
What makes it better?
Nothing.
And are you currently receiving any type of medication for this headache?
Every once in a while.
Every once in a while, like medication, like pain medication or something? Okay. All right. I'm going to check the IV. So I'm going to check the dressing, make sure it's intact. I'm going to make sure, see if there's redness, any swelling, any type of fluid around the bandage, and I'm going to check to see if there's any pain. Is there any pain at this IV site? I'm also going to check the size of the IV. I'm going to check the clamping to see if the clamping is open. If it's open, it's continuous. If it's closed, it's saline lock. And then I'm going to check the tubing for any type of bubbles and any type of kinks. I'm going to check the drip chamber for make sure it's half full. I'm going to check the bag to see what type of solution it is, the clarity of it, the expiration date. If it's past 24 hours, I would notify my RN, and I'm going to check the amount that is in the bag. I'm also going to check the pump to make sure, see what it's set at. I'm going to check your oxygen. So I'm going to take out the nasal prongs, look inside the nares, and to see if there's any redness or irritation. I'm going to point the prongs down in the nares. I'm going to check the cheeks and behind the ears for any type of redness or irritation. I'm going to check the oxygen tubing for any type of kinks also, and I'm going to check to see what the flow, the rate of it is at. Check the Foley, so I'm going to check the size of the Foley, 16 French. Make sure it's attached to either side of the leg. I'm going to make sure, see what type of color or clarity of urine that is in the tubing. I'm going to check the bag to make sure that it is on the bed frame, and I'm going to check to see the amount of urine in the bag, and I'm going to change my gloves. Okay, I'm going to ask you, where are you at right now?
I'm in Health and Sebring.
And what is today's date?
April 14th.
Okay. I'm going to check your your pupil size. So just look straight at my nose. 3 millimeters. When I'm trying to lighten your eye, just keep looking straight at my nose, okay? I'm going to check for facial symmetry, so can you smile for me? Open up your mouth, stick out your tongue and say ah. I'm checking the oral mucosa, make sure it's pink and moist. Alright, I'm going to check for skin trigger. And I'm going to wipe my pen light off. Alright, have you been any type of shortness of breath? Are you coughing any?
No.
I'm also checking for a use of accessory muscles while breathing. So I'm going to clean my stethoscope. All right, I'm going to check your lungs. Just take a deep breath in and out. I see so. Take a deep breath in and out. I'm under the gown with the stethoscope. Checking, I'll check the back side of the lungs when I roll, when we roll, okay? So I'm going to inspect the abdomen, make sure there's no abnormalities, and I'm going to auscultate, so I'm going to wipe my stethoscope off once again. Okay. I'm going to gently just press on your stomach. I'm going to palpate your stomach, your abdomen, and I'm going to make sure there's no tenderness, okay? So just let me know if there's any type of pain. Checking the patient's facial expressions. Okay, when was the last time you had a bowel movement?
Yesterday.
How much was there? Was it a large, medium, or small amount?
Large.
And And what was the color of it?
Brown.
Consistency of it?
Firm.
Okay. When was the last time you passed gas?
This morning.
And have you had any difficulties urinating?
No.
All right, I'm going to check your strength and resistance. So just squeeze my fingers. Just squeeze as much as you can with that hand. Okay. Can you, I'm going to ask you to move your fingers for me. I'm checking for color, capillary refill, and I'm going to check for temperature and pulse. Also, I'm checking for edema, looking for edema as well. All right, I'm going to press down on your arms. Just let me, just press up against me, okay? Press down. Can you press up for me? Press down. Press up. Press down. All right. Look at your toes for me. I'm checking for color, capillary refill, temperature, pulses. See if there's any edema in the legs or feet. Checking my heels. I'm gonna change my gloves. Are you experiencing any type of numbness or tingling in your body?
No. Yes.
Where is it at?
Right side. Left side.
Okay. And I'm just going to check to make sure I didn't miss anything before I walk out. Okay. I'm going to telemetry, make sure there's no telemetry. See if there's any telemetry. Okay. I'm going to make sure the bed is down. Oh, I forgot about the backside. Almost forgot. Okay, so I'm going to have you roll over. Okay? So do as much as you can, okay? So just roll over. Here you go. I'm going to wipe my stethoscope down. Take a deep breath in and out. In and out. Okay, I'm also checking for any redness or any type of skin issues in the backside. All right, you can roll over now. Okay, just gonna make sure I didn't miss anything else. Think I'm good though. All right, going to let your bed down. I'm going to make sure the half side rails are up. Here's your call light. Where would you like your bedside table at?
Right there.
Okay. And evaluating the overall appearance of the room. Okay. Before I leave, is there anything I can do for you at this moment? Do you need to go to the bathroom, any type of pain medication, or are you comfortable?
Oh, good.
Okay, so to use this, you just press this button right here, and I will come as soon as possible, okay? And I will be back within 1 hour. All right? So I'm just gonna clean all my equipment before leaving. I'm gonna take my gloves off. Wash my hands. Thank you for allowing me to be a part of your care today. Would you like your door open or closed?
Open, please.